So we've come to the point in our class where we want to talk about advancing and improving your skill set and improving and moving up in your career as a clinical research coordinator. So what I've done here, by the way, welcome back. I'm Steve Pope and glad to have you back this week. So I put up here for the purpose a couple of snippets from ICH E6 R2 guideline, essentially the responsibility of the investigator and the responsibility of the sub-investigator. In many trials and at many sites, sometimes the coordinator can be listed as a sub-investigator. You'll see them on the 1572, you'll include them, in not every case, but in some cases they are. So they act, behave very much like a sub-investigator. So the point I'm making is that you're going to be part of an overall team conducting the trial. The investigator is going to have the overall responsibility of supervision, but some of that supervision is going to come to you as well in your role, and we're going to talk more about that as we go along. So let's look at our learning objectives. We're going to discuss the changing role of the clinical research coordinator. We're going to describe methods for advancing and improving your coordinating skills. We'll cite additional training resources for coordinators. And then finally, we'll discuss how to assess your progress in expanding your role and skills. So let's talk about discussing the changing role for the clinical research coordinator. Probably a big change that's occurred over the last 10 or 15 years has been that of risk-based monitoring. And that's not necessarily, it is a change for monitors, obviously, but it's also a change for coordinators, because what's going to happen is you're going to have monitors, coming out to your sites more infrequently than they used to. They're only going to be looking at a small set of data a lot of times when they come out. And then they're also going to be using this central monitoring activity with you. So what that means is you'll probably have a series of what's called site management calls, which may be calls that are about 15 to 20 minutes long, and those are done maybe every 2 weeks or so, or on some sort of regular basis. And so you're gonna have to have some preparation for those, because it can't just be the same thing over and over again, on each of those calls. So, and what that's going to generate, it's going to generate review of the data at your site on a more frequent basis, which of course is going to mean there's more queries coming at you. So you're going to have to manage that. So that's what I mean by risk-based monitoring and the central monitoring activity. It's no secret that trials are getting much more complex. There seems to be a trend toward having more complex trials, but having fewer participants and even fewer sites than we've seen, sort of in the past. What that means is you've got a lot more vendors that you're working with. Vendors and the complexity of what they bring adds another dynamic. It adds another layer of activity to you and to your site. So where you might have had only 1 or 2 vendor platforms in the past, now you're having 4 or 5 in many cases. You've got a central labs vendor, you've got an IWRS vendor, you might have a central imaging vendor. You could have vendors that are doing other activities such as keeping track of dosing data, things like that. So there's just more complexity in the trials. You're using a lot more handheld devices, which could be a tablet that you might have at your site, where questionnaires are administered to the subjects when they come in, and then the subject gets a little smartphone where they keep track of any adverse events they experience, or update any ConMeds that they have changes to. They keep their dosing diary on that, and then that's something that needs to be done every day. So what do you do if they forget to do it? What happens if they go on vacation for a week and they leave it behind and they don't have access to it? These things happen all the time, and they can be a real headache. So that's something that's adding to the complexity of these trials as we move along. So there's going to be greater expectations of competency, and I'll get into that here in just a moment. So this wheel that you see here is what I like to call the clinical research wheel. So what it is, it shows you the various competencies that exist in our industry, and your role as the coordinator is really going to touch on maybe only a small amount of each one, but you're going to be participating in that. For example, scientific concepts and research design. That's going to be embedded in the protocol, the study protocol that you get from the sponsor. So you're going to need to understand a little bit about that as you read that, so that it makes sense to you. Ethical and participant safety considerations. That's a huge part of what you're involved in your coordinator role, keeping subjects safe and not introducing more risk than necessary. Investigational product development and regulation. That's something that you're going to touch on slightly. I would go ahead and include the investigational product management activities into that particular category. Clinical study operations, that's your good clinical practice, so you're going to be heavily involved in that. Study and site management, you're going to be the principal site management person at your site, so you're going to need to understand those concepts. Data management and informatics, this is a big one. And this is an area that a lot of coordinators do not have a whole lot of training on. And it's one of the things that I've noticed over the years in working with coordinators is that they need to have a little more understanding of what is going on behind the scenes by the data management team and why they're getting the types of queries that they're getting. What's the difference between a medical monitor query and a data management query, or an auto query versus a manual query, those kinds of things. Leadership and professionalism, that's important. Your site is a key component to the research that's going on for that particular product in that particular therapeutic area. And so you play a key leadership role in that. And then finally, number 8 is communication and network and teamwork. And that's not only for your team that you have at your site, but it's also for the clinical team that maybe works at the CRO, within the leadership team that works for the sponsor. So you've got a number of different teams, a number of different stakeholders in that arena that you've got to kind of be aware of. So let's talk about methods for advancing and improving your coordinating skills. I think the first one here is very important, thinking like a site owner. That's very important because a lot of times with these sites, you'll find coordinators that sometimes don't have a whole lot of experience, and in many cases there's not someone coming behind them to sort of make sure they're not making mistakes. And so thinking more like a site owner, taking ownership of tasks is something that's very important. And that can be true if you're in a large academic site or a large institutional site. Just taking ownership of what you're doing is very important. And I think that's a key to success in working at the site. Viewing the site from a trial management perspective. Learning ways to improve how trials are conducted. Flattening out the process is usually a good term, a good way to think about that. And that's something that you'll do as a coordinator. The last one on here is anticipating issues and risks. That's very important because you're going to as you get into a new trial, you're not always going to know what the risks are until you get started with it. And then you figure out, oh, this is an area where we didn't anticipate there being a big issue. For example, working with technology. Um, as you might be aware, if you've got an older population of participants, of patients, using technology solutions is going to be more of a challenge because they're going to have a bigger challenge with some of that technology. And so it's going to create more work for you. So, being able to do that, being able to anticipate those kinds of things and, eliminate mistakes or at least mitigate mistakes is going to be key to being a successful coordinator. So let's talk about some training resources for coordinators. So quite a few coordinators come to the role from an RN background, and they have good training in RN type medical tasks. When they move into that coordinator role, the regulatory piece of it and the overall dealing with vendors and things like that, it becomes more of a challenge. So, having some fundamental training in that area, such as this course, can be extremely beneficial, but it's only a first step. So, where do you go to improve those skills, to gain additional training? And there are a number of bachelor's and master's degree programs that are out there, many of which are online, so you can live anywhere. I've listed a few of them here because I'm based in the North Carolina area. I'm familiar with some of the universities here. University of North Carolina at Wilmington, it's a good school, has both a bachelor's and a master's program. Campbell University, which is located here in North Carolina, is a private school. It has also a bachelor's and master's program, as does George Washington University, which is located in Washington, D.C. And these are all online. They do have a classroom component if you live in that area. Drexel University is located in Philadelphia. Also has a good program there, good master's program that's fully online. Ohio State University, although I'm not sure they actually have a degree program, they do have, I think, a certificate program that I would imagine is probably pretty good. I know less about that particular school than I do the others. But there are a number of bachelor and master's programs that are available that can help you gain additional skills and move up at your site and at your institution. So professional development organizations, these are very important. Two of the bigger ones, the Association of Clinical Research Professionals offers their Certified Clinical Research Coordinator certification. There is a work requirement that you have to meet for that, and some educational requirements. And then once you meet the eligibility, you can sit for the exam. And then once you pass that exam, then it's good for 3 years, and you'll have to have some CEUs, continuing education units, in order to renew that at the 3-year mark. And the same is true for the Society for Clinical Research Associates, which is another professional development program, and they have their Certified Clinical Research Professional degree, which is a little more oriented toward the regulatory side of things than the CCRC certification is, but both of these are very beneficial, and they establish a basic foundation for you, and it shows that you're willing to go to the effort of getting certified and showing improvement in your career. The other component is that both these organizations have local chapters that are international, that are around the world, certainly here in the U.S., and you can attend some of those local meetings where you might participate in worthwhile discussions on a particular topic. They also have a global conference that moves around from location to location each year, and those are good to attend. You meet a lot of people there, and you can gain a lot of knowledge in participating in those global conferences. They also have publications that you will get with your membership, and you'll have access to those, and those are very, very beneficial as well. You'll learn a lot from reading those publications. Your organization may have institution sponsored training. If you work at a large research institution, they'll have training courses that you can participate in. They probably have some that you're required to do, at least initially, when you get into the role. But they'll have other training that's available to improve upon as you go along. There's also private training programs. There are quite a few of them, and these are becoming more and more popular. And you'll find those out on the various internet sites. Some of them can be fairly expensive. They might be in the $500 to $2,000 range, depending on what it is. I would just encourage you, if you're going to do that, make sure you check it out, make sure you get a good understanding of what topics are going to be covered in that training before you commit to it. And you certainly want to know, is everything going to be delivered remotely? Is it online? Is there a classroom portion? Do you have to travel someplace in order to do that? Those are all the questions that you want to know before you get started with that. And then finally, we want to talk about how to assess your progress in expanding your role and your skill set. So first of all, let's talk about sort of understanding what your role is in the first 2 years, because you'll learn a lot during those first 2 years. You'll probably learn more in the first 2 than you really will in the first 10. But it's all going to be fairly new to you, at least originally, at least in the beginning. And so you want to make sure that you're working on a variety of trials. You want to gain more therapeutic experience. The more therapeutic experience you have, the more marketable you become. And then, because you probably aren't going to stay at the same institution for very long, at least initially. So you want to make sure that you're expanding your therapeutic knowledge in that. You're probably going to be working in a department, in an area where there's multiple coordinators. So your institution's probably going to have, kind of a CRC1, then a CRC2, then a CRC3. You probably have a senior coordinator role, and that's probably one that you would be looking to get into maybe around 10 years in the field. So those are going to be things that you want to take a look at. You want to be able to assess how good of a site leader you are, and I think it's important to take some real honest to goodness hard look at that and begin to learn. What do I need to do to be a better leader? Do I need to expand my therapeutic knowledge? Do I just need to become more familiar with these complex trials? What do I need to do? Is there a certification I need? And really kind of give that some serious thought as you're progressing. Another area that you're probably going to be involved in as you gain more experience is you're going to be mentoring new coordinators. So you're going to have new people that come into your site that probably are not going to have a whole lot of experience. And so you're going to need to mentor them. And that's really a good way to improve your own skills. I've always said the easiest way to improve your skills is to go teach something. So and then you're in the role of a mentor. You're in a kind of a teaching capacity with someone that you're working with there. So these are some areas that will kind of help you progress in your career and in your role. And it's good to kind of take a basic understanding of where you stand on each of those. So for your readings, I've included 2 reading assignments here that'll kind of amplify what I've gone over in the lecture. The first one is what PIs want when hiring a clinical research coordinator. I think you'll find that article to be very interesting. The second one is a center with or without a coordinator. The coordinator is an integral part of the research team. There's a particular set of authors, conducted some fairly extensive research in multiple sites in multiple countries, and came up with some good conclusions that I think will help you, understand your role a little bit better and understand, kind of what's important out there. So finally, we've got our discussion forum assignment for this week. So what I want you to do is I want you to, plan your future. Where do you think you want to be, at some, milestone into the future. So I want you to develop your professional and career plan with milestones at each stop. Begin with the end in mind. I think that's very important. Think about where you'd like to be maybe in 10 years. Maybe you want to be in a management role at a large academic site, for instance. Maybe you want to be in a completely different role. But think about that. And those articles that I gave you will kind of prompt you a little bit on that and maybe give you a few ideas. So then once you kind of have that in mind, then identify what you need to accomplish in order to get to the next level. So, I think the best way to do that is to start with some basic questions. So what does it take to get to the next level? Do I need a certification? Do I need a degree? Do I just need more years of experience? I mean, what do I really need? And then, do I need to apply for a different role in my company or go elsewhere? For some of you, you're going to work at smaller sites where there isn't going to be a whole lot of opportunity. And so you may wind up having to go elsewhere in order to make progress. And then finally, how do I take on greater responsibility? This is something that you can be proactive with. Let your investigator know what ideas you've got in that area, kind of solicit them, get their discussion on it. Then, so think about that plan and then formulate it. You don't need an elaborate plan. Something that's probably 200 words or fewer would be fine. And then go ahead and post that on the discussion forum, and I'll take a look at those, and then I'll wrap things up, at the end of the week, as we normally do. So have fun with it. I think it'll be a good exercise to work on. Let me know if you need help.